everyone, to Women's Health Tech Wednesdays. I am your host, Nina Joshi. A couple of quick announcements before we bring on our guest for today. We have our April symposium coming up at the end of next month, or this month. Make sure that you get your tickets for that. And we also have our HitLab Innovator Summit in person in New York City. And the QR code, as well as a link in the chat, will also have the information to grab your tickets for that incredible event as well. And with that, I'd like to formally introduce our incredible speaker for today, Dr. ElShadey Bekele, who is a pediatrician at Children's National Hospital. As you know, we love questions here at Women's Health Tech Wednesdays. So if you have any, please use the Q&A feature or the chat, and I will make sure that we get to it. With that, thank you so much for being here today, Dr. Bekele.
Thank you for having me.
I am so excited to dive in and learn all about yourself, the work that you're doing. So maybe a great place for us to start is if you could just tell us a little bit more about your career journey. What has kind of led you to where you are right now?
So I am a general community pediatrician. I got into that because I'm very interested in preventative health and as well as caring for the child and the whole family. I've been doing that for about 10 years post-residency. And then I've also gotten into clinical informatics, which is the melding of IT and health. And I do some work with coaching for providers around the electronic medical record, and worked on a project to implement and design a new system for us. And then with a lot of the interests I've had, I started becoming interested more in management and logistics. So I got my MBA recently to try and work more in that area. And I am the associate medical director of our clinic.
Wow, that's incredible. That's what kind of prompted that initial kind of push towards peds? Was there any kind of specific moment that was that catalyst or something that you kind of knew just in med school that you wanted to pursue?
I mean, I've always had a passion for kids and have loved spending time with them. When I got to med school, I decided I'm gonna start with a blank slate, try everything, see how it was. And every rotation I did, there was just like, oh, I don't like that. I don't like that. What am I left with? It's peds. So it's like, okay, I guess I was right coming in, but
Yeah.
I just wanted to eliminate other choices first.
Yeah, absolutely. Yeah, it was destined. It was destined to be. So I love
Exactly.
that. That's incredible. There's so much that I want to dive into, especially because you not only are just a practicing physician, but you have just all of the different lenses that you now have with the clinical informatics and the management. But maybe we can just kind of start with the more clinical kind of side of the role that you have. I'm so curious what I think, number one, just interested to see, are there any particular misconceptions about pediatric care, about the department at large, that you kind of like are now seeing being debunked as a practicing pediatrician?
I think there's a couple things. I think one thing, people just look at children as little adults, which is not correct. Like even within pediatrics, we look at the different age groups very differently. An infant, a
Oh,
newborn is very different from a toddler, who's very different for a school age kid versus an adolescent. And we see kids all the way up to 22, so that's young adults. So we see the whole spectrum. And even when you're thinking about specific medical disorders, you may handle it in a different case based on age. So your differential will be different. The testing you'll do might be different. Screenings for each age are different because they're at risk for different things. So it's almost like you have multiple different types of patients by age group within that. And then you also deal with adults. I think a lot of people are just like, oh, you just do what you do for adults. And I've seen many times adult practitioners who come in contact with kids and either are freaked out because an adult, it would be an emergency, whereas a normal in a child, or vice versa. So I think that would be the first thing. The other thing is, oh, all the pediatricians do is give vaccines. That is definitely a large part of it. And,
Yeah.
We're all about prevention. So that for sure is a thing. But it's just one piece. I think it also gets construed that way because vaccines often are required for school. So some of the time people see that as the value.
That's super helpful. And I think just on that note too, because I know that you are really just centered and focused on prevention. And when you were speaking about just the almost like within peds, there's all of these little cohorts in a way that I also wasn't, I kind of forget too. What does that kind of look like from a prevention standpoint? Because there's all of those nuances. I'm just kind of curious, like what that kind of looks like, or what your lens on what prevention is when you're dealing with so many different cohorts within the umbrella of peds.
Yeah. So I mean, that comes into our preventative care model. At each age, there's recommended screenings by age, and then we do like mental health screeners, developmental screeners, and those are all by age as well. So, you know, a kid who is 2, we're going to be screening for autism. A kid who is like preteen, we're going to be looking at cholesterol. So it's all been worked out and set up in a pretty good grid, but then you're always, you know, through your history, assessing for different risk factors and what other things might come up, which are individual based on the kid's environment, family, past history, all that kind of stuff.
Absolutely. And I'm curious. I want you to like, I don't know, maybe I'm wrong. Debunk it for me if I am wrong. But I'm curious because I think prevention, you know, when you think about like the preventative measures, the screenings that we have as adults, and you know, when you think about like just whether it's affordability, access, all of these things can be just these hinderers when we are the ones that are in charge of it for us. I'm curious, do you kind of run into those same barriers when you're thinking about like pediatric prevention, or are those kind of milestones hit with a bit more of a regular cadence than like adult prevention?
Yeah, I mean, I think with like you're saying with adults, it's based on your own care. So like you have to get the buy-in of the parent or guardian, whoever that person is caring for the child,
Right.
in order to be able to do that. So when you're doing screeners and the parent's like, my kid is fine, I'm not going to complete that, you know, it's hard to get information. When parents are like, oh, my kid is healthy, or I'm not going to get vaccines, I'm going to miss 2, 3 visits. And those are the times you're usually doing those screeners, and you're doing them early so that it has more of an impact on prevention. Yeah, you kind of have to develop that partnership and have that buy-in from the caregiver in order to be able to do it well.
100, that's a very good point about just like that added layer of the support of the caregiver kind of being such a big factor in any kind of healthcare decision making. Um, I'm so curious, Dr. Bekele, because you know we hear this all the time about like how the pandemic has disrupted like this industry and this industry. I'm so curious, like what does pediatric practice look like in a post-COVID world? Have there been like really big changes in the way that you're practicing, or has it maybe stayed the course?
I wouldn't say in the way that we're practicing, but I think both from like a workforce standpoint as well as the individual patient value add, or the value what they see as the value has changed. I think patients' access has decreased related to staffing, and workforce decrease related to burnout that happened during the pandemic. And then attendance to appointments. I think we're still seeing people who like have not been seen for a few years because of the pandemic, and then afterwards, you know, just took a while to catch back up. And then that relationship with the provider and the patient, I think, has been a little bit fractured, especially like a lot of families had a lot of issues around the COVID vaccine and, you know, didn't want to get it. And so, and more vaccine hesitant people are coming out. So then that whole discussion between vaccines can somewhat prevent that relationship between the provider and the family from being as strong. So a lot of ways.
That's really interesting. I think some of those like nuances or like the relationship component of pediatric care. I think that is something that is a little bit unique to your field. So that's really fascinating to see how that's kind of just evolved. And when you were saying that there are folks that haven't been seen for a long time, like with the pandemic, I wasn't expecting to hear that. That's crazy to even think about, but I'm sure a very real reality.
Definitely, especially preventative care. Like some patients might have come in for like a runny nose or something, and then, but still haven't had addressed like chronic issues. So yeah, we definitely see that.
Wow. I'm so curious because when you're not, just doing, seeing patients and kind of in that lens, I'm so interested to learn about some of the other aspects that you have, just with the skill set that you've developed. And maybe we can start with some of the things that you're doing with like the clinical informatics side of the house. I'm so curious, what are some of, if whatever you can share with us, are there any particular like initiatives or projects that are kind of top of mind for you right now?
Well, I think the biggest one is we changed EHRs almost 2 years ago.
Mm.
So we were involved in trying to design it properly for primary care because the rest of our hospital system was already on it.
Mhm.
So primary care was the last to join. So that was a lot of like working on workflows and seeing how we could incorporate the EHR capabilities into what we do. Right now, I think the hospital has been assessing some things, so we're trying to see if we're going to change again or not. um,
God.
so I think right now we're focusing on making sure that people are optimizing the current system and
Mhm.
using that well. Um, and then there's things like AI scribes that are being trialed and it's trying to see how that integrates with the EHR. I think that's the biggest one that's going on right now.
Oh yeah, that's definitely like a very like hot use case for AI is kind of that scribe or like that decision support. I'm so
Mhm.
curious, like what is your as someone that is like can put on her doctor hat, but also her like clinical informatics hat, how has kind of your experience with like AI just as a workflow kind of modifier supplement been just within your own practice?
I think it's actually delayed because
Mm.
as an individual provider, you don't have as much access to what you bring into that innovation space, which is something I'm highly interested in. And I could see many use cases, but from an enterprise view, you have to do all this trials and everything. And it's not like you can cherry pick on my level, like cherry pick what you want to use. And then, there's costs and assessments and everything that have to be done with everything. So I think they're, strategizing as to how to make that effective for the largest number of people. But I think AI has a lot of potential and using tools like in like Copilot and Microsoft and stuff like that are starting to become more well used. But I think in general, in historically speaking, I think medicine is a little bit slow on the uptake, and especially with things
Mhm.
like EI, people are a little hesitant um, to see what with medical management, that kind of thing.
Totally. And it's really interesting when you were kind of almost talking about like the funnel of like as a provider, what your view is versus someone that's kind of seeing the enterprise level. I kind of didn't even really think about that of as like an individual physician, what you can and can't have access to. I
Mhm.
didn't even like that's a really fascinating nuance when you think about like the implications or just the applications of AI. That's so
Yeah, we're actually started a lean transformation project where it's like quality improvement kind of stuff. And with lean methodology, you think about using the frontline people to generate ideas and come up with solutions. And I think healthcare is usually the opposite. They
Mhm.
manage from top down.
Mhm.
Um, so then it becomes harder to make innovation happen that way and also to I think to pick the right tools.
No, for sure. I can definitely see how that would be the case. And I'm also so curious too, because I think actually on that funnel, when you're thinking about how it's historically been, I almost kind of feel like when you think about like the front lines and the physicians, kind of the care team, um, they're not only thinking about the ones since they're the ones that are actually doing the care, like they have their own perspective, but they're also seeing what patients are doing too, because I feel like there's just with, wearables and there's just all of this technology that patients themselves are kind of bringing in or asking to be brought in. I'm kind of curious, like, how are you kind of seeing the use of technology? I think in the pediatric space, is that something that is, super, super integrated, or is there a big push for it? Or maybe not so much.
I don't think I've seen that so much. I think we will definitely in the near future, like especially as EHRs are trying to start to connect to those things, because at this point, I don't think that interoperability is at the status that it needs to be to make that easier both for the patient and for the provider. I think in adult care, usually they tackle that a little bit more early on,
Mhm.
especially like diabetes care and that kind of thing. I think that's one opportunity, even with pediatrics, that is, it usually they do take good advantage of it. But in more adult care, I think that's where people target more often too. So,
Right.
you know, you have a larger population, it makes sense. But I think if we could get pediatrics in that early on, and there, I mean, of course, there's people who are trying to do that. Just I don't think as the same scale as with adults.
But yeah, it's the next innovation, it's the next frontier. So
Exactly.
it would not surprise me if in the next, few
Yeah.
amount of years we start to see that.
Yeah, definitely.
Good. I'm also so curious to Dr. Bekele around your kind of recent accomplishment with your MBA. Would love to learn a little bit more about what kind of prompted you into this program and how you kind of feel like it's just, added a different perspective or lens to the work that you're currently doing.
Yeah, so my interest in that since I started being an EHR coach and then getting more into the clinical informatics world and seeing how much that world is tied into our workflows and our efficiency of practice and all that kind of stuff.
Hmm.
But then also seeing with COVID how healthcare, like the agility of healthcare to respond to something like that in our public health systems and everything. I became very interested in that logistical side. And so I tried a few classes in the clinical informatics space and it didn't really bridge everything. So then starting to look, like I always looked at an MBA as not something that I would ever do, but then it incorporated human resource management, logistics and operations, getting some of the finances, which, you know, in order to be sustainable, you got to learn some of that. So it just gave me so many different things that people are not typically trained for within healthcare. So that's why I went for that.
That's amazing. Yeah, it's like adding more like tools to your tool belt, so to speak.
Yeah.
That's amazing. How are you? Are there kind of ways that you're already starting to see like how just your MBA knowledge is like coloring maybe your perception about certain projects or things that you're working on?
Yeah. I mean, I think you know, people don't want to think of a healthcare as a business, or some people only want to think of it as a business. But to me,
Mhm.
a business means something where you have policies, procedures, standard operating procedures, you have a way of doing things, but you are constantly reassessing it and trying to improve it. Like that's what you're doing for a business for in terms of profit. But in healthcare, I think of it as you're doing it to improve the quality of the care. So
Right.
this in continuous improvement state of mind is what I get out of that. And it gives me ways to look at different processes and workflows and reassess it. So now with our quality improvement project, that's what I'm really trying to focus on. And there's so many aspects you can address with that, like from all stakeholders' point of view, from the patients, from the providers, from the staff. So I think it just gives me a more well-rounded perspective to do that.
That's incredible. And whatever you kind of can share with us, are there any particular initiatives as you kind of are thinking about kind of quality overall that is top of mind for you? Is there kind of like because that I feel like quality is such, to your point, a very large ecosystem with so many different stakeholders. Are there kind of particular places to start that you all have been working on?
Yeah, so I mean, I think it's very particular to the field you're working in, since we're in pediatrics and specifically in outpatient general pediatrics, it goes to a lot of our preventative kind of things, like are people screened? If they're screened, what happens to that? You know, what is the follow-up? All that kind of stuff. Like in order to have quality, you have to be able to track metrics. So
Mhm.
also making sure that like the metrics we're using, our registration system versus our EHR, are they talking to each other? If
Right.
they're not talking to each other, what do we do? And how do we catch that? So it's a lot of the like interoperability kind of things in terms of
Mhm.
the systems as well as the people. So like if something's happening on the administrative side, but the clinical side doesn't know, how do we fix that? Um,
Very
yeah, so
complex.
it's getting into those details.
That's so fascinating. And I think it will be interesting to see when you think about how with just technology, there's even probably going to be more like small little cogs and parts that all kind of need to be working together. So I think it's
Yeah.
great that that's something that's already like just so top of mind for you of what that kind of looks like in harmony, so to speak.
Yeah,
Um,
and also like not putting too many things on one system, right? Like if
yes,
you have to have 10 applications open to see one patient, like you're gonna miss something.
for sure. No, that's such a good point of like make it, efficient, but also very seamless and very easy for the end user. Um,
Usability is key.
yes, absolutely. And I'm also kind of that actually brings up a really interesting question too. I'd love to learn of, I'm sure just when you are thinking about like in your clinical informatics hat and managing and as well as practicing, you're probably seeing a lot of just like chatter or kind of ideas that are just coming, percolating. Are there any particular like innovations or areas of opportunity where you would like to see like innovation of, oh wow, like this is really like a white space or a gap where there's something really amazing can kind of come in to plug in here?
So in pediatrics and lots of medicine, we talk about social determinants of health a lot.
Oh,
These are things that impact your health that aren't actually medical. So, if you can't buy your next meal and you're starving, you're one, not going to be interested in much else and not be able to do much else. Plus,
right.
it's going to affect, especially with children's, your ability to learn, your ability to, function in society and on a, individual basis. We know that these things impact and are like some of the highest determinants of health. Um, but we don't really track that well. We don't really have EHRs that are good to document that. We need to work with so many different people, social workers, case managers, subspecialists in order to address such things. But I don't think EHRs or other tools that I've seen at least work
Yeah.
very well to highlight that. And those are things that you're going to have to follow through time. So, you need that longitudinal view as well.
Right.
And then, there's a bunch of different things people try to do to address that, to show interventions. This whole thing about quality improvement, if it's not documented, it's not done. If you don't see that you are trying to address these things or where that change is happening, it's really hard to follow those and focus on them.
Absolutely. That's such an interesting point. And you are right in the sense of, it's something that I think is talked about, but really like putting forth the infrastructure to kind of do it longer term. I think that is incredible. And a really, really important area, especially I think from your perspective too, as like from a PEDS perspective, just really the implication. So I feel like that is definitely a good white space for any innovators that are listening. This is a big area of opportunity.
Definitely.
I
If
love it.
anybody has any ideas on that, I'd
Yeah.
love to listen.
I also want to ask you, I know you kind of talked a lot about, I mean, and we've all kind of collectively seen really the burnout and kind of what's been happening just in the wake of the pandemic. I'm kind of curious, like as just as an individual, a practitioner, but also kind of working in all of these different lenses, are there any particular, strategies or advice, things that you use to kind of maintain that work-life balance or kind of that mental health aspect? Any things we can learn from you?
Yeah, I can share with the things I try and do. I'm not perfect either. Um, but I definitely try and create that separation. When I'm home, I try and be home. I try not to have like, I know a lot of people have their Teams app or, email from work on their phone. I try not to download those or at least not have notifications so that I don't get interrupted. When I'm with my family, I try and allocate at least the 2 hours that I'm off work. Like I'm not supposed to be using any digital device. I try and keep my phone on do not disturb during those times. Like emergency stuff is of course available. I try and keep doing work 2 hours when I have kids. So when they're asleep,
Mhm.
that's what I did with my MBA when I took classes when they were asleep, which obviously not always a possibility. But when it is, I can. I also try and like set expectations. If I'm going to something and I'm on call, and I'll need to answer the phone or go check the computer, I let people know ahead of time so that it doesn't seem like I'm rude or whatever. But trying to set that out. Also trying to, have that mix between work from home and work in clinic, just because I do have administrative time, so I can do that as well. And, trying to be realistic with yourself about time commitments. If you know you're going to have a meeting and you are going to need to write notes or summaries and stuff afterwards, like baking that into the calendar block that you're putting so that you have that time blocked. You're not like, oh, I'm just running from meeting to meeting without having time in between to reassess or prep or whatever, but like blocking out that time so you already have that. I like, there's a tool called the time matrix where it's 4 quadrants and you put tasks there based on the urgency and the importance. So it kind of helps you prioritize what needs to be done, like what fires need to be put out. And then it also highlights that you need time for planning and strategizing. I think that's something that people often don't do, or at least don't plot time for. And sometimes that's helpful to like plot time out to do it with somebody else, because people are often not very adherent to their own blocks when it's just for themselves. So if you can include somebody else, an accountability buddy or whatever, or if there's somebody else that you should be partnering with to plan something, then putting that kind of time on your calendar as well, so that you have time set aside for it. It's not like, oh, where am I going to fit it in? And it ends up being a last minute kind of thing.
I love that. That's actually such incredibly tactical, incredible advice. There's so many, I'm like, oh, I should probably do that. I should probably create those buttons.
I like practical tips.
I love it. And for everyone that's listening, this will be recorded. So if you want to go back and remember those tips, you definitely can. I also realized we're so close to the end. I feel like time just flew. But one of my kind of favorite questions to ask as kind of the last question is, I mean, when you think about just your career, all of the incredible work that you're doing, do you have any just general career advice for us, for folks on the call, as they kind of think about navigating other, aspects or passions that they like, or just advancing kind of in their given career? Any words of wisdom for us?
So I think, I think a lot of people, especially driven people, end up doing too much, and not focusing a lot. So what I heard someone say once was to create a mission statement for yourself so that you know what you want to focus on. Like, I want to be a community pediatrician. That's it. So how am I going to get there? Like, lots of things, tasks and stuff that may come to you may or may not be working towards your own personal mission. So you need to be able to triage that, and like the things that are going to focus and get you to your goal, those are a yes. The things that are not, you need to put that to the side, or like maybe do that as a volunteer thing or something outside of work, so that, I'm not saying you can't do any passion projects or anything else, but like if you're very mission driven and like focus on that statement that you write, then it helps you decide. Just because if you get too many things on your plate, it usually is harder to get there.
That is a game changer advice. That's going to be the next thing I do when we hop off, is to think through, what is my mission statement? I feel like that's so powerful, and it's almost kind of like this great North Star for you too. So I love that. Wow, what a way to end. That's such a great tip.
Awesome.
Thank you so much, Dr. Bekele, for just incredible insights, just with all of the work that you're doing, but also great kind of lessons and learnings for us too. I so appreciate you taking the time to chat with us.
Thank you so much. Hope you all have a good day.
Thank you so much. Make sure you join us for our next Women's Health Tech Wednesdays. Wanted to give a quick shout out to our sponsors, as well as one huge thank you to our guest for an incredible discussion. We will see you all next week. Bye, everyone.